Thank you, Mr. Chair. My name is Benjamin Aker. I'm an emergency medicine physician, and I'm here representing the South Dakota State Medical Association as its president. I'm here to ask you one thing today, and that is don't break up the team. From the nurse to the physician, to the dietitian, to the physician assistant, to the dreaded CEO of the hospital, everyone is there for one reason, and that is to take care of the patient. And I don't think anyone in this room or this virtual room thinks otherwise. You know, the goal of the design of a physician assistant as a career is that a physician assistant is a healthcare professional licensed to practice medicine with physician supervision. There's supervision there. And you might not like the term supervision. It can be collaboration. It needs to be someone who you can talk to when you have a question or a concern, who's there and ready to answer your questions. That happened to me when I was out of medical school. 4 years of medical school, double what a physician assistant takes. I was still not ready to be an independent practice, but I sure wanted to be. I thought I was as a resident physician. And I agree now that says that I wasn't ready and I needed to have supervision. And so I had an attending physician to ask. And that's what happened when I saw a patient with abdominal pain. I'd seen hundreds of them. And this patient with abdominal pain, I ordered magnesium citrate. Luckily, it wasn't given. That would be a medication that would help with constipation. This patient turned out to have a small bowel obstruction. And my attending physician said, wait a second. She had years of experience. Let's do the CAT scan first. And sure enough, that's what's there. You know, it's not the 99 sore throat patients that you see. It's the one patient with sore throat who also has a lymphoma, a cancer that can be deadly. I hear the argument that supervising physicians in rural areas are retiring and we won't have anyone to work with. That is a challenge, and that's a problem. But this is not the way to do that. The supervisor is not required even to be in the same town. And so if a physician moves away, there's still other ways to get other supervising. But a better way to do it is to use telemedicine or to pick up the phone and call. I have 15 years of experience now, and I still know that being able to ask someone with more training and experience is vital, especially those for whose training is a lot shorter than a physician. The Physician Assistant Education Association, which is the association that represents physician assistant education programs in the United States, says we do not support the elimination of legal provisions that require a collaborating physician. They believe that independent practice would be a risk to patient safety, and I'm worried about that as well. Another argument is that physicians wouldn't come to the table and negotiate, and that could not be further from the truth. I've been on the board for many years, and we've had ongoing discussions for several years. I met with physician assistants by phone in the president and their immediate past president, and we just couldn't come to a compromise. I don't know that there was an intent because they felt that they had the votes to pass this. We don't agree with training hours. The initial 520 that was put in there so that it could be amended to 1040 is not enough. Just a few weeks of education is not enough to be independent. The president of the American Association will come on later to elaborate how this is extreme compared to any other state. And that supervision needs to be not just with only a physician assistant or physician, it needs to be with a physician. An argument is that I haven't spoken with my physician in months. I'm already independent. Well, that's a problem. That is a problem. You need to talk to your physician if you have a question or a concern or you see a patient that just doesn't seem right. And that's what we don't want to lose. And we lose that with this bill. In closing, this bill will not result in more physician assistants moving to rural areas. We saw this with nurse practitioners. Instead, what we got was profitable medical spas in Aberdeen and Mitchell. What this bill will do is break up the healthcare team. It's going to worsen provider shortage. A better thing to do is to focus our efforts on team-based care, telemedicine, and training. I would urge you to vote no on this, and I'll be available later if there's questions. Thank you.
I'm a pediatrician, and my name is Jesse Barando. I'm a physician in Mitchell, South Dakota. I was born and raised in rural Falk County, South Dakota, and I visited with several of you on the phone, and I emailed all of you on House Bill 1163. And I believe we share a common interest in providing quality health care to the people of South Dakota. Much of my family lives in smaller rural communities in South Dakota, and for these reasons, I have worked to extend my practice to the small and rural communities of South Dakota to telemedicine, which I believe will do more for our state to improve healthcare access than passing House Bill 1163. I appreciate the working relationship that I have with physician assistants, and I'm happy to help them take care of our patients. However, I do not believe they have the skill and training to practice medicine independently. 2 years of training is simply not equivalent or comparable to the 7 to 10 years of training of a physician. Or if we want to go by hours, that's not 1,000 hours, that's 10 to 16,000 hours after medical school. Oftentimes, it is during residency training that a physician truly learns to practice complicated medicine and learns to address those issues that go beyond the basic common cold or routine medical care. Residency training is something physician assistants simply do not get. Another way of saying this is you do not know what you don't know. And I take calls weekly from nurse practitioners and PAs that I'm happy to help with, but simply they're kind of intern level questions. They're not that complicated questions, not questions that somebody who is ready to practice independently would be asking. It's important that we question the claim that House Bill 1163 will improve healthcare access in rural South Dakota. As was previously mentioned, the independent practice of nurse practitioners did not result in an influx of APRNs to rural South Dakota as they claimed it would. As a matter of fact, the vast majority of them continue to practice in cities like Sioux Falls, Rapid City, and Aberdeen. Why should we expect differently if House Bill 1163 is passed? However, granting independent practice of APRNs has resulted in the opening of the health spas and cosmetic shops in Mitchell and Aberdeen, as Dr. Aker has just mentioned. These entities have not improved access to health care in rural areas or quality for that matter. Finally, as a physician, these ideas are truly disheartening to me. It gives myself and other physicians the impression that our years of training and experience are not important to South Dakota. I'm further concerned that passing of House Bill 1163 will discourage current and future medical students from taking up primary care specialties, and it may discourage physicians such as myself from practicing in rural South Dakota if our experience is not deemed important. Thank you for your time.
Okay, thank you. I think next up we have Dr. Susan Bailey. Are you online?
Yes, I am. Good morning. Can you hear me?
Yes, we can. Go ahead and introduce yourself and begin.
Thank you so much. Good morning, Mr. Chair and members of the House Health and Human Services Committee. My name is Dr. Susan Bailey. I'm a practicing allergist and immunologist from Fort Worth, Texas. I'm very honored to be here with you today to provide a national perspective as you consider House Bill 1163 and its impact on patients in South Dakota. Doctors across the country have very serious concerns about this legislation. Not only does it replace physician supervision with a weakened definition of collaboration, it completely removes physicians from the care team by allowing collaboration to occur with a physician or a physician assistant. No other state in the country allows this arrangement. There is no model for this. House Bill 1163 also goes too far by only requiring collaboration, whether it's 520 hours or even 1,040 hours, which just translates to a few months for a full-time physician. After this time, physician assistants can practice medicine or surgery. There's no standardized curriculum and there is no certifying examination, so you have no idea what happens in those hours of collaboration. Now, not only is this drastically less than 10,000 hours physicians complete, as you've heard, during their 3 to 7 years of residency, but it's vastly different from any other state. A few details on this. 40 states require physician assistants to be supervised by physicians, including South Dakota. Of the remaining 10 states, 1 requires physician assistants to have a written practice agreement with a physician. And in 9 states, physician assistants must collaborate with a physician, typically through a written agreement. In some states, the supervision or collaboration agreement must specify the tasks that are delegated to the physician assistant and specific protocols for prescribing medications. Many states indicate that the physician must be directly involved in and continue to have responsibility for patient care. This is very different from the language in House Bill 1163. Only 3 states limit the collaboration to a specific length of time, all much longer than 3 months. And unlike House Bill 1163, these states require this collaboration with a physician, not another physician assistant. And in addition, these states limit the types of facilities that a physician assistant can practice or require them to have a practice agreement with a physician or their employer. So I gave you a lot of details about what's going on across the country, but here are 3 things I'd like for you to remember. First, the vast majority of states require physician assistants to be supervised by a physician. Secondly, no state allows physician assistants to serve as the collaborating provider of other physician assistants. It's always a physician. That's the model in this country. And third, patients want a physician managing their overall care. House Bill 1163 moves healthcare in the wrong direction by removing physicians from the care teams. And when you remove the most highly educated and trained healthcare professional from the care team, you inevitably put patients at risk. So as an example, data from research has shown that nurse practitioners and physician assistants in states with independent prescribing authority for Schedule II opioids were 20 times more likely to overprescribe opioids compared to those in states that required physician involvement to prescribe. That's really frightening. So as we work so hard to reverse the nation's opioid epidemic, I'm sure you can agree that this clearly demonstrates the need to keep physicians as the leader of the healthcare team. If the team is not functioning in a way and patient care is prolonged, that doesn't mean you break up the team. That means you need to strengthen the team. So we believe and hope that you agree that all patients in South Dakota deserve optimal health care that is provided in teams led by physicians. I encourage the committee to preserve physician-led care and oppose this bill. Thank you so much for giving me this opportunity to present. Thank you.
Mr. Chairman and members of the committee, I'm Dr. Rob Allison. I'm a general internist from Pierce, South Dakota, and I've been practicing here for 22 years. I've employed and worked with physician assistants and nurse practitioners throughout my career. I'm a past president of the South Dakota State Medical Association, and I was the physician member on the Governor's Primary Care Task Force from 2012 through 2018. I testify today as the governor of the South Dakota chapter of the American College of Physicians, representing its 485 physician members in our state and the 163,000 members nationally. The ACP strongly believes in supervised collaboration within healthcare teams and that the preservation of the healthcare team is the best model for evidence-based outcomes of quality care. House Bill 1163 would remove supervised collaboration from the healthcare team, which would negatively affect quality of care. Healthcare professionals have different training, skills, knowledge bases, competencies, and experience in patient care. Years of critical thinking and decision-making are the most important components for being prepared to take care of a routine or complex patient, something not built into shadowing a provider or observational training. It comes through experience, making independent decisions under the watchful eye of an experienced teacher. The ACP believes the purpose of healthcare professional licensure should be to ensure public health and safety. House Bill 1163 would develop 2 separate standards of medical care for the public. Licensure should be evidence-based. It should protect the public from receiving care from clinicians that is beyond their skills, training, clinical experience, and demonstrated competency. There's no evidence to suggest 520 hours, 3 months, 13 weeks, or an amended 26 weeks post-licensure is enough training and critical thinking experience to be able to care for the patient independently by this legislation by a physician assistant, or what would be equivalent to a second-year medical student in our program. The ACP believes that hours of critical thinking and training and preparation of independent practice matter. House Bill 1163 does not meet this standard of training. Although some training and competencies overlap, physicians have many more years of training. The range of care appropriately provided by each discipline is not equal, as suggested by the hours, which will be used by our Board of Medicine to determine the same information. A similar example of safety and training could be the safety measures employed by the FFA, not allowing a pilot with a private license requiring 30 hours to fly in training to fly a commercial plane without the needed 1,500 hours of hands-on experience. In summary, supervised collaboration is critical for the preservation of the healthcare team. House Bill 1163 would result in 2 different standards of care for the people of South Dakota, and the amount of training to provide safe, quality, independent care is much greater than 3 months or 13 weeks of clinical experience post-licensure. Thank you for your time. I will stand by for questions afterwards. Thank you.
Okay, Mr. Chairman, good morning to you and members of this committee. Thank you for the opportunity to testify. My name is Dan Heineman, a family physician, and I'm a registered lobbyist for the South Dakota Academy of Family Physicians. The Academy represents 317 family doctors, 52 family medicine residents in residencies in South Dakota, and 139 students. Family doctors of South Dakota recognize the valuable contributions of physician assistants and believe that physician assistants should function in integrated practice arrangements with practicing licensed physicians. The Academy encourages healthcare professionals to work together as clinically integrated teams in the best interest of patients. Patients are best served by a healthcare team led by a physician. You have heard about the significant differences in education and training hours that we believe are key to the understanding the differences in quality of care provided between physicians and physician assistants. Primary care is not easy. More and more South Dakotans are living with one or more chronic disease, and this adds to the complexity of primary care. This care is best delivered by a coordinated team led by a physician. Quality assurance activities are routinely not part of independent practices, so not all practitioners will have care evaluated in a meaningful way. Licensing boards evaluate a practitioner's care if and when a complaint concerning the care has been brought to their attention. It might be difficult for a patient to understand if there's an issue with the care that they have received. In my previous position as a medical officer, I have seen greater number of care issues related to what I would call inexperience of the advanced practitioner. The South Dakota family doctors urge you to vote no on House Bill 1163, which releases physician assistants from practicing under a collaborative agreement. Thank you for allowing me to testify. I will stand by for questions, especially if you have questions about quality and safety. Thank you very much.
Okay, thank you, Dr. Heineman. I think we have one more online. Is there anyone else in the room that's opponent testimony? Do we have any other opponent testimony in the room? Then we'll go back online to Lane Blasius, if I pronounced that right, a medical student. Are you online?
Yeah, that's correct.
Go ahead and introduce yourself and begin your testimony.
Great, thank you. Mr. Chairman and members of the committee, good morning. My name is Lane Blasius, and I'm a second-year medical student at the Sanford School of Medicine here in South Dakota. I grew up on a ranch outside of Wall, South Dakota, so I know firsthand what rural healthcare looks like. Because of that, it has been my goal to help better the rural healthcare in our state by going into primary care in a rural community like the one I grew up in. I also have a younger brother who aspires to do the same. After hearing about this bill, he called me distraught, concerned that this was going to disrupt his career plans. He said, "Why would I go through 7 years of medical school and residency training to become a primary care physician when I could train for a little over 2 years and be able to perform the same services? Plus, my education will be much less expensive." As I near the end of my second year of medical school, I look back on these 2 years as the most rigorous time in my life. The amount of information I've learned is beyond anything I could have ever imagined before starting medical school. Yet, I feel as though I've only seen the tip of the iceberg. It truly scares me to think that in 2 short years, I will be a doctor in residency making decisions. If I were in a physician assistant program under this bill, I would be less than 6 months away from being able to practice independently. When I put myself in those shoes, it truly terrifies me. I know that I'm not ready. My classmates know they aren't ready, and medical students in the classes above us know they too are not ready. We know this because skipping steps of preparation in this field means that we could hurt someone. It means that a wrong decision may result in someone dying. Let me present you with the scenario. Imagine that your mother, who lives in small-town rural South Dakota, becomes severely ill. You go to see her and determine that you need to take her to the local emergency room. It's the middle of the night, and you're hours away from any other hospital. You frantically get checked in and enter one of the rooms. And then I come in and tell you that I, a medical student, will be providing care to your mother. How would this make any of us feel? Most of us are not comfortable receiving care from a medical student, and yet most medical students have much more training than what this bill would require of a physician assistant. I know you want to find ways to improve access to healthcare in the small towns of South Dakota, but this bill is not the answer. Telemedicine, rural residency programs, physician-led healthcare teams, and providing effective incentives for medical students are ways we can continue to shore up the healthcare in South Dakota. I hope you've been able to see my perspective this morning and that it will help in your decision-making process. I would greatly appreciate your support in the opposition of House Bill 1163. Thank you, and I will be available for any questions you may have.
Okay, thank you. And with that, we will end the opponent testimony and offer rebuttal.
Thank you, Mr. Chair. I will do my best to be brief here. There's a lot to unpack here, though.
Again, Dr. Rob Allison, speaking on my own. I came back to South Dakota to practice in rural areas, and I'm from Nebraska. So I specifically came to Pierre 22 years ago to practice in this environment. We train internal medicine and family medicine students. 85% of those people who train will come to rural communities. The rural residency program built here in Pierre by this legislature will build individuals who want to practice, and we're already successful in having those people. So I think those concepts of care bring physicians to rural communities effectively, and then they stay.
Mr. Chair, I live in a rural area, not the most rural part of South Dakota, but we're about 30 minutes from any healthcare where I live. And I'm just wondering why rural areas would be not entitled to more, having physicians or healthcare providers with more training and education. Why is a rural area less than a more urban area when it comes to having qualified healthcare providers?
7 ayes, 6 nays.
So 1163 as amended, we'll move to the 41st day. Thank you, everybody, for your testimony. So moving on, let me pull up the next bill here.